Good afternoon. My name is Harjit Bansal. I'm head of Equality, Diversity and Inclusion, and I'm here to share a case study of becoming a RIDI award-winning organization in disability-friendly recruitment. So just a little bit about my organization. I work for NELFT, NHS organization. We are an integrated community and mental health services for people living in the London area. We've got community health services in Southwest Essex, so we cover Basildon, Brentwood and Thurrock. And then we've got emotional wellbeing mental health services for children and young people in Essex and Kent. We're a very diverse workforce, over 740 staff with disability in the organization, which is 19.8% of the overall workforce declared having a disability as part of our staff survey, and 5.7% of those who declared having a disability were recruited in the organization, which are good positive picture to have as an NHS organization. So why the award? The organization was preparing towards level 3 application for disability confidence. We felt we had done quite a lot in the organization and really wanted to be part of the applications for the RIDI awards. This award was critical in terms of committing ourselves further on the recruitment and meeting some of the health inequalities agenda. I think it was also an opportunity for us to reflect on what we had achieved and were hoping to achieve in the future. And most importantly, we wanted to be part of the RIDI family. So just some of our achievements, we were disability confident winners in 2020 by EI organization. We won a gold award winners for talent, inclusion and diversity um, uh, um, evaluation. Sorry about that. Gold award winners for talent, inclusion and diversity evaluation. And so we wanted to also be part of the RIDI. Some of our challenges are the geography of NELFT. We have over 125 sites with over 7,000 staff. Sometimes not getting right support at the right time is a big challenge. Access to work, the process is also a huge challenge. People's disclosure, people not saying that they have a disability, hence we are not able to meet some of their needs. I think there's underrepresentation in our workforce of the community that we serve. There's lack of knowledge of managers to make reasonable adjustments. There's lack of accessible information technology. And how do we make this everybody's business? So it's not something that is just for the EDI team to do, but it's actually people supporting the staff within our organization. So what actions did we take? Our first one was about having a disability staff network. Now the network has been critical in terms of its leadership. It's got a strategy in place. It's got a budget. It's got people who are passionate about disability and improving the outcomes for our staff. And we wanted to do some partnership working with both voluntary and public sector organizations to learn from what they were doing. In terms of recruitment, we have a disability confident logo on all of our recruitment communication and emails and letters. We offer guaranteed interviews to all our candidates who disclose having a disability that meet the essential criteria. We offer reasonable adjustments as part of the application form, the assessment test and the interview process. And all of our assessments, including the interviews, we allow them extra time, and that depends on individuals, so it's not a set time for people. We provide written questionnaires. The questions are given to the candidates prior to the day of the interview so that they can prepare the answers before they come in to be interviewed. We have ring-fenced apprenticeship funds to recruit people with learning disabilities. And I'm really pleased to say we recruited 5 last month, and there's lots of support in terms of ambassadors and a buddy system for them so that they feel they're part of the whole organization. All chairs who are chairs of interview panels have to undertake an e-learning training which covers disability and unconscious bias. So that's something, it's a minimum requirement for all interview panel chairs to complete this selection process. Our IT software is adjusted for all online assessments and interviews, and we have in-house built licenses for TechSelf, Read and Write, and Dragon Champion users who can also support people. And we have flexible working, job sharing, shadowing, and work placements for all our staff who've declared having a disability as part of their support. The other work streams that we have is the Calibre Leadership Program. It's a program for anyone who wants to become a leader in the organization and develop some of their social skills to become the next leaders. We have access, like I said, to TechSelf, and we've bought in licenses for Dragon so that we can give those to people rather than waiting for access to work to recommend that for people. This year, we're going to do reverse mentoring. Like I said, we've got disability ambassadors who are hands-on help for anybody who needs help anytime within their work environment and when they're at work. We've also got dyslexia drop-in surgeries. These are 2 days a week where staff can go in for support. But even if there are question marks about their learning disability, they think they might have dyslexia, they can go in and have a chat at these drop-in surgeries, and they're very, very popular. We have actually had 100 people who have accessed this since April last year. We've got lots of awareness training sessions that we run throughout the year, things like neurodiversity, deaf awareness, mental health, and autism are some of the standard ones that we deliver every month so that staff and managers are aware of what they need to do in order to support our staff. I think all the work in terms of having an impact, whether it's had a positive impact or not, we've got lots of results that tell us that we are in the right direction. So 70%, 80% of our workforce who declared having a disability said that the trust provides equal opportunities. Over 50% of disabled staff said that they were satisfied with the extent to which their organization values their work, and that number is not is low for us, but it has really improved in the last couple of years from 39% to 50%. 82% of disabled staff felt that their employer had made adequate adjustments in the workplace, and engagement has sort of there's a way that we measure ourselves around the score of disabled staff engagement, and ours increased from 5% to 7% this year. And 5.1% of staff have declared disability showed an increase of the number of overall staff in the organization to 6% this year from 4.3 last year. So again, we are beginning to see huge improvements in the work that we are doing. And there's, let's say, some work that we probably need to do with medical staffing. But again, we are seeing an increase in medical staffing declaring having a disability when they come and join our organization. There's some key learning we have to do and for some further development that we are working on this year. So we're looking at doing reverse mentoring at a board level. So we're doing this through Disability Connect mentoring scheme. And we're really, really excited. All the board is signed up to it. So we're hoping to run it in March this year. We are carrying out an accessibility audit. We are reviewing all IT equipment and training products that we use in the organization to make them accessible for staff with disability. Quality self-assessment reviews on our employee system. We want to make sure that we have more and more people who are declaring a disability so that we can support them in the organization. Disability ambassadors, we want to carry on developing their skills, and we've got a whole lot of program to make them a bit more equipped to meet the needs of our staff. This year we want to take on more Kickstart people. We've got 3 in my team, and overall in the organization we've got 40 Kickstarters, and the ones on placement in our team are all those with a mental health or a physical disability. And again, they're going to be with us for 8 to 10 weeks, and they're going to share their learning within the team. We want to use a platform to advertise more and encourage positive recruitment for people with disabilities. So we're approaching organizations such as Diversify to see how we can promote more of the work of the NHS and recruit more people. So finally, my key messages, I guess, I want to leave for people who are looking to improve the outcomes for people with disabilities, to have leadership at the very top in the organization. I think that has been critical for us, that our chairs and our board members are engaged with this agenda. We have a strategy in place which ensures that it sits at the board level and the accountability sits at the board level. Develop a strong and robust disability network which has very clear objectives, and accountability is critical. Seek out a budget to deliver on your strategies. No use having a strategy that sits on on the shelf and you don't have the budget to deliver on it. Work with partners, both local, national and public. And I think we have a lot of learning to do from private and voluntary sectors as well. So we're embedding that as part of the work that we do. Collect and report on data. I think data is critical to show evidence that what you're doing is actually having a positive impact. Offer training and development for all staff and empower them with guidance. We do that all the time. Every time we have a session, a webinar on disability, we ask the trainer, could you just write up a guidance for us? Address any challenges head on. Don't be shy and don't shy away from them. Every challenge has a solution, and bring people along with you. Be inclusive rather than exclusive. So thank you all, and hopefully I'll share my details with you if you want further information. Thank you.